really appreciate the really appreciate the opportunity for all of us to have an exchange on some really important topics and efforts in our community. So thank you to the HCRI, Brittany and Carson, for making this possible. Amy and I are really delighted to be here with you today and want to talk a little bit more about food insecurity and share some of what we've been seeing during the pandemic. Hunger is oftentimes a hidden condition. And I have people frequently ask me, how come we don't have hunger in Idaho? Food insecurity just doesn't seem to be like it's impacting us in Idaho. And, we see on the TV the long lines of cars that are waiting to get food in other cities, but that doesn't happen in Idaho. How come? Well, it does happen in Idaho. And so it's an opportunity for us to talk about how hunger is often a hidden condition, and that's not by accident. People who are dealing with food insecurity and hunger don't really want to be that visible. It's not something that they want to stand up and make sure that everyone is aware that they're going through those struggles. But at the Idaho Foodbank and with our partner network, we're able to reach those who are struggling and provide the support that they're needing. So today, Amy and I want to touch on a couple of key points. Go ahead to the next slide. And we want to get through this, in the first part, so we have lots of time for questions, because I think that's where we can have some great conversation and discussion. We'll talk a little bit about the Idaho Foodbank. Sometimes I think everybody knows about us, but I realize that's not true. And so we'll take a little bit of time to share some overview information. And then also want to touch on what we've seen during the COVID-19 pandemic and responses to that. We've learned a lot about the food supply and food distribution through this time. And finally, we want to share some great work that Amy is leading for us in our Hunger to Health strategy and focusing on healthcare collaborations to address community needs. So just to start with, as an overview, the mission of the Idaho Foodbank is to feed, educate, and advocate for those who are struggling with food insecurity. And we do that in collaboration with a number of community and state level partners. There's no way we could do this work alone. So we do a lot of collaboration and also working with public policy leaders, both on the state and the national level, to secure programs and support for those who are facing food insecurity. So let's talk a little bit about our reach across the state. We have 3 facilities, distribution facilities. Our largest is in Meridian. We also have a facility in Lewiston and Pocatello. And from those 3 facilities, then we have a vast network, and that's illustrated on the map by those colored balloons. We could not do this work or reach the people who are in need without our community partners. And you can see there that we have 465, actually more than that now, community partners that help us reach the people where they are throughout the state of Idaho. I'll touch on a couple of programs here and then we'll work into a little bit more on the next slide. We have some programs that are very tailored to specific audiences, and the top 3 on the list on the left-hand side show the backpack program, which is a program designed for children who need food over the weekends. And so we build that into a backpack and make sure those in high need children have that food over the weekends. School pantry allows us to have access right in the school building for those families who need to come and get food for the whole family. And then our senior program also targets that specific population of our seniors who are struggling with food insecurity. But let's take a look at some of the locations and the partners that we work with listed here. Our key focus, as I said earlier, is collaboration. So we're working very closely with more than 200 schools across the state to have food pantries located in those buildings. It's a very safe place. People feel comfortable going into their neighborhood school. So it's a great access point for them to be able to get the food that they need. We also have many emergency food pantries. We work with senior centers. Some nonprofits offer free food through meals, so the feeding sites, emergency shelters, like, oh, you're familiar with the Boise Rescue Mission, Salvation Army, some of those organizations. And then we also have what we call a mobile pantry program. And this is designed specifically for the high need areas and our rural locations in Idaho. We have some very small communities in rural areas where they may not have an organization that can operate a pantry. So we identify those communities and a point person in that community. We set up a day, a defined day and a time. They work within the community to communicate when we're going to be there. And then we roll in with our truck, and over the course of a couple of hours, we're able to distribute the food directly to those people who are in need. And they know we're going to be back again the next month, so they can count on us to provide that regular support for their needs. And through this food distribution network, we're currently reaching nearly 200,000 people every single month. So that takes a lot of coordination throughout this network to make it happen. And there's a lot of incredibly committed people who are involved in making all of this work. Most of them are volunteers, and we'll talk a little bit more about that. Let's go ahead and look at what does this mean over the last 10 months as we've been dealing with the pandemic. The Idaho Foodbank is a member of a national association of food banks known as Feeding America. You may have been hearing about them on the news. They've been doing some great stories about hunger across the country. One of the benefits of being a member of Feeding America is we have access to some really great research about hunger. And it's research at the national level, but also at the state level and down to the county level, providing us with really good numbers. Pre-pandemic, we were pretty excited that our food insecurity numbers in Idaho were coming down to a lower level than we'd seen since the Great Recession. This is how long it has taken us to recover from the Great Recession. Really excited to see the 1 in 9 individuals struggling and 1 in 8 children. Now, you don't want to see any at all, but these were lower numbers, as I said, than we'd seen in more than 10 years. And then the pandemic hit, and Feeding America did some great research in helping us understand what the impact could be. Through that research showing us that the numbers could go up to 1 in 6 individuals and 1 in 4 children. And you can see there on the slide that that was a 49% increase in overall numbers and a 75% increase in children. Of course, that was very alarming. So we immediately went to work in March and identifying what do we need to do to address this increased need. So our initial goal was to increase our food distribution by 30%. We had to have a starting place. So we just said, let's set our targets to 30%. And we immediately started looking at our distribution systems and what we needed to be able to do to reach that increased food distribution. So on the next slide, we've got a highlight of some of our elements of our response plan and lessons that we learned. Since May, we have increased our food distribution beyond that 30%. We're at about a 44% increase in food distribution to meet the need. And on a monthly basis, that's an additional 800,000 pounds. You'll find people in food banking talk about pounds of food a lot. But what that means in terms of the meals, if you look at how many meals that will provide, on a monthly basis, we're providing enough food for 2.2 million meals. And again, that's reaching nearly 200,000 people. So a very wide reach and significantly more food moving through our system to meet those needs. Now, in addition to increasing the volume of food, we had to adjust our models for distributing the food. Excuse me, previously, we'd be able to send food to our partners in cases. So they'd get a case of beans and a case of corn, and they'd be able to unpack those cases, put them on a shelf in their pantry, and then people could come into their building, into their pantry, and select the items off the shelf, just like in a grocery store. to select the foods that they were wanting at that time. Well, obviously with the pandemic, we couldn't operate pantries in the same way. So we quickly shifted, and again, working with our network of partners to distributing prepared food boxes. So we would mix the food inside a box so that there was a variety. We'd ship those boxes then out to our partners, and at the local level, then they set up the mobile distributions where the cars would drive through, and they put the cases of food inside the vehicle. People could no longer come into their buildings. It was really amazing, and this is a great example of the resiliency that we saw, not only within the food bank organization, because we had to shift overnight to this prepared food box model, but all of our partners that were distributing at the community level, they did the same thing overnight. They closed down their indoor pantries. They set up the outside distribution model. They retrained their volunteers. They adopted all of the safety practices to make sure they had the social distancing and mask wearing, extra sanitation. And we didn't miss a beat across the network. I think we had 2 of our partners out of the more than 400 who had to close down, but that was very briefly, and then they were back online. They ramped up the services. They knew they had to distribute more food. Many of them extended their hours so that they could reach more people. It was very impressive to see how quickly their response spread across the state. The other thing that we've seen is a historic amount of food purchasing for the Idaho Foodbank. Previously, we've been able to acquire the volume of food, nearly all of the volume of food we needed through donations, through our grocery store partners, our food manufacturers who donate truckloads, semi-truckloads of food to us. But when the pandemic hit, you remember how the grocery store shelves went empty? There was a significant interruption in the food supply across our country. And suddenly that food was not available to us. I mean, literally overnight, that food was no longer available to us. So we had to quickly pivot and start looking for opportunities to purchase food because we needed more, not less food. That was a big shift for us in our budget because we weren't used to spending that kind of money, but we had to. What we see now between April and October, we've spent over $2.2 million. That's 11 times our annual budget. In a typical year, we would spend $200,000 in the whole year. And just that part of the year, we're over $2 million. So again, a big shift, and we cannot thank the generous donors in our state enough for allowing us to be able to do that because of the generous donations that they've been making. We're still in that period of time of trying to figure out what the future looks like. The food supply chain has stabilized somewhat, but there's no way we'll be able to get enough donations to meet the increased need that we're facing today. So our planning work, we're getting really good at scenario planning. I can't even tell you now how many scenarios we have. It's becoming part of our normal practice to create or update our scenarios. So if we look at the kind of the growth over the years that's happened, wanted to show you the picture of what this looks like for the Idaho Foodbank. And these are in fiscal years. But you can see that we've been on a steady growth. And this is in response to the needs in the state and being able to provide, doing more work to identify where those needs are and expanding our reach into more communities across the state. We were on a great growth pattern, very well managed. And then when the pandemic hit, all those plans went to the side. And where we are now is well beyond what we saw in terms of our planned growth over the next 5 years. So when we end our fiscal year, which will be at the end of April this year, we're expecting that we will have provided food for 24 million meals, which is well above the 18 million in our last fiscal year. Fortunately, it's been sustainable to this point. What I do want to also call out again in terms of the resilience that we've seen through the pandemic is the fact that we couldn't have done it without volunteers. We just absolutely could not. I have 65 employees, full-time employees statewide at our 3 locations. We have had to add a few temporaries during this time, but it's the volunteers that have made it possible to take on the additional work that's been required. And as you'll see at the bottom of the slide, if we add up all of the hours that are donated by our volunteers, it's the equivalent of adding 33 full-time employees to our workforce. If we had to hire that many more people, that cost that goes into paying those people takes away the money we need to spend on food. And our volunteers understand that. And that's one of the motivating factors that keeps them coming back on a regular basis. And we did not see an interruption in our volunteer support during the pandemic, which has been incredible. So I'm going to stop talking so that Amy has a chance to share about our Hunger to Health strategy.
Awesome. Thank you, Karen. Did we want to take any questions right now or move through and finish up and do questions at the end?
Let's go ahead and move through and then we'll do questions at the end. But feel free for people who do have questions to throw them in the chat.
Perfect. Awesome. Thank you so much, Karen. So the Idaho Foodbank, in response to growing awareness of the impact of hunger in our communities, recognizing that hunger is a piece of our overall health and our overall community health. You know, as we look at the people we're serving, we see people who are food insecure, who are needing a little bit of help to put food on the table. And it's not just food that they're struggling with. Often it comes with a myriad of other conditions. Maybe they've been diagnosed with a chronic health condition, and they're looking at how do I best treat my diabetes or my high blood pressure, or perhaps they're experiencing trouble paying their rent or their utilities. And when those things compound, people are making decisions about where do I spend my money and what takes priority. So kind of all of these things together and this awareness of how linked hunger and food and health is in our communities led to this development of our Hunger to Health strategy. So in 2018, the Idaho Foodbank kind of brought together some community representatives to help inform and drive a strategy around how we initiate with our communities, how we engage with our communities, and the work that we can do to further our mission of a hungry-free Idaho. So to lay a little bit of foundation in order to kind of frame this conversation about food and health and hunger, want to just touch on food and health as food is a social determinant of health. And some of you might be familiar with the term. It's becoming a little bit more popular in our terminology these days, and our understanding of what all comes together to impact somebody's overall person and health. So just briefly, the CDC has a great kind of easy to understand description of it. It's social determinant of health are the conditions and the places where people live, learn, work, and play that affect a wide range of health and quality of life risks and outcomes. So, we know that our health as a human is not just related to how many times we go to the doctor. It's impacted by our genetics and how we were brought up and where we live and where we work and our behaviors. And some of those behaviors include diet and food, and do we have access to food? So it's all this big web that comes together. So again, Idaho Foodbank is looking at, through this Hunger to Health strategy, how do we meet people where they are, where they live, and how they operate, and the education that they have to support their health through nutrition, education, and community collaboratives. So that's really what drove our strategy, is kind of fell into 3 pillars that we're starting to look at, and 3 initiatives that we're focusing on: nutrition, education, and healthy communities. So the first nutrition focus is, first of all, we need to be providing healthy food through our partner network. So we've focused really on defining what a healthy food is and educating our internal staff and our external partners about what is a healthy food. So happily and very excitingly, we've been able to provide 80% of the food we distributed in fiscal year 2020 was considered nutritious, which, and Karen will attest to it, is actually a shift in thinking for food banking, and especially in Idaho. Just even taking that step has been really incredible. The second focus is education. So, we're able to provide healthy foods. That's a great focus. We're getting those out there. Let's help people understand how to use healthy foods, and why is it important to even consider something, what is nutritious versus non-nutritious? How does that impact your body and your mental health, and kind of all other aspects? How do you use it? How do you cook with it? So we've worked on providing educational classes through Cooking Matters courses, which currently are on hold due to the pandemic restrictions on social distancing. But that's a class that is offered. It's a 6 week course just focused on how to prepare healthy foods. We provide recipes through our partner newsletters, and we distribute educational resources through our partners to just get out into the community. We also have something coming up, a virtual community health forum aimed at educating our partners and our community health partners just about that connection between food, health, and food insecurity. So there's so many different ways in which you can just provide education. We're trying to hit them all, and really open to feedback and interested to see which ones are super effective and where can we go next just to distribute this information. I know me myself, sometimes I get those recipes and I've tried a couple of them, like, oh, hey, that's a good new recipe to try. So the last focus and pillar is healthy communities, which is something that encompasses this idea that we can't do it alone, and we're a community that is here to support our community. Food connects to health, connects to our infrastructure, connects to housing, connects to it. Just a community needs to be brought together to support those who live in it. So we've focused on collaboration with healthcare providers, schools, nonprofits, government, and other industry leaders to be a part of the conversation about how can we lead, how can we provide any sort of subject matter expertise, how can we be a part of creating new solutions to existing or new problems. As you can imagine, it's been really interesting to be a part of this conversation, especially now during COVID. Conversation is a little bit different than it used to be last year, and it's different looking forward to how we're going to respond next. Some of the collaboratives and task force that we're currently involved in, and it's just kind of a highlight, but we have the honor and the opportunity to be involved with WHC and Alexis Pickering, who presented a few months ago, the incredible work being done with that. There's a Nampa COVID-19 task force, which is really focused on the city of Nampa, bringing together community leaders and agencies in that region about specifically serving Nampa. There's an Elmore County Health Coalition that we're able to be a part of too. Healthcare partnerships have been huge, and we're so excited to be able to be a partner in those conversations about just the link between food and health. In St. Luke's, the Idaho Primary Care Association, which is the group of federally qualified health centers throughout the state, and the public health departments have been just part of these ongoing conversations. We've got a few different initiatives, for example, like co-location of services, so providing a flu clinic in conjunction with a mobile meal distribution, or providing a health screening in conjunction with a mobile meal distribution. So when a family is experiencing food insecurity and getting food on the table as a priority, they're coming to get food, and we're providing the opportunity for them to also get a health screening when maybe they wouldn't be able to make it to the hours open by their health center, or they only have gas to get to the food distribution and not to the health center. So that's been a really cool opportunity that we're looking to expand upon as well, part of that meeting people where they are. And then the last aspect of community engagement, we're really looking at how do we, again, connect and engage with our communities to understand their needs, to understand where they're at, and how we can be meeting them differently. We've just hired 2 community liaisons through a grant through the Feeding America Network, which has been an incredible opportunity. They're a temporary employee right now, but they're focused on connecting with the Hispanic Latinx community in Nampa, and then the Native American tribal communities throughout our state, forming connections, but also looking at how can we be, again, meeting these people differently? What do they need? What are they interested in? How are we not reaching them? Can we provide culturally appropriate foods that are, you know, more appropriate for what is, you know, part of their culture and what type of food they typically eat? So these are all kind of brand new conversations that's really amazing to be able to have. And there's lots more. Happy to provide more information about that if anybody's curious. And the last thing I'll land on is, in this framework of social determinants of health, multiple needs, you know, again, coming up when somebody's experiencing food insecurity, it's typically not just that. So I'm sure you're all aware that part of our work here in our community is figuring out how to connect our pieces and how to leverage all of our strengths to be able to serve. So, you know, oftentimes we see community resource guides come up, which are incredible, but also really cumbersome to keep updated. And as soon as you print them, they're out of date, and it takes a full-time person just to try and coordinate that. So findhelp.org is an organization that we have identified and are championing. It's a nationally based organization, but it is a very comprehensive network and listing, essentially, of all the social care services in a community. It's a certified B Corporation, as well as a high trust certified, meaning they adhere to HIPAA guidelines and standards. St. Luke's, St. Al's, Kootenai Health Center up north, they're all starting to integrate this into providing additional resources to patients that they see come in. The idea with this is, if we can, as a community, collectively kind of get on board with this, and everybody start using one centralized database, we'll be able to really leverage a lot more information. There's an ability to make referrals through findhelp.org. So if I identify somebody who needs some support finding housing, I can refer them, you know, through findhelp.org. There's even an ability to do an intake assessment that is then connected to that individual. So somebody who's accessing different resources doesn't do 10 types of intake assessments, which we know is both cumbersome, but can also be re-traumatizing to the individual to have to repeat that story over and over, and might be a barrier to them accessing that. So findhelp.org is a really great, just kind of, I think, comprehensive network that we're interested in pursuing. So that is the end of our presentation. So thank you so much, and excited for questions.
Thank you. Woo. Thank you, Amy and Karen. That was wonderful. So Amy, maybe if you want to stop screen sharing, then we can kind of see people, which I enjoy. An audience, if you feel brave and want to show yourself, feel free. But if not, that's fine too. So I'll start off with a quick question, and then we've already got some questions in the chat. So this is the question I've asked all of our speakers so far, which is, and maybe both Amy and Karen, you could answer, in the next 5 years, what would you like to see for the Treasure Valley and our community?
Well, you know, I've often shared with people that as excited as I am that we have just moved into a new and larger facility in Meridian, I would rather turn that into a skating rink. I wish we didn't need it. I would love it if we would see a decline in food insecurity so that we didn't have to work so hard to find ways to meet the community's needs. Think we can do that in how many years, Carson, did you say?
5 years.
Yeah, so that's really our goal. You know, I keep telling people we're here to provide the support that's needed, but we really don't want to be growing our business. That's not our goal. We'd rather be downsizing.
Amy, do you have any thoughts?
Yeah, I agree with Karen. I think, you know, as a service organization, let's try and work ourselves out of a job. So I love what I get to do with Idaho Foodbank in this way of connecting to other organizations in our community. I'm hopeful that that's part of the way forward, you know, that we all become, you know, just this really powerful network of support that has a greater impact together than individually.
Yeah. Yeah. I mean, listening to you guys speak, it just feels like what you guys are doing is such a good model for everyone to kind of take on, because you have like your ability to be so resilient in this crazy time and make things happen for people who need it. It was just so impressive. So it's really inspiring and exciting to hear about the work that you guys are doing. Okay, I'm going to move on to some audience questions. So let's see. Someone asked, were the donations that you received enough to cover the $2.2 million that was spent on food, or was that money covered elsewhere?
I can say that at this point, the donations have covered that additional expense for food. And I mean, the donations are from every corner you can imagine, from individuals, from corporations. We were also able to secure our first time ever state grant through the CARES funding. We were given $2.56 million for food purchase and food delivery. So the donations have been meeting that need. Our concern is going forward and trying to project for how long will we need to have these heightened expenditures. How much funding is that going to take? How long will this funding last us to be able to meet this level of need? And that's a challenge in front of us.
Thank you. Lindsay Turner, you were next on the list and you have a little thing here. Do you want to go ahead and just ask away?
Sure. This is wonderful. And it's so great to see all the work that you're doing. I've been studying Healthy Hunger for Kids Act, so a lot of the federal policies and the USDA aspect of the hunger safety net. And it seems to me that all of the pieces that work together have been strained, right? So Karen, as you said, at a time when everyone was grocery shopping, you needed extra supplies too. So there've been these sort of all these strains in the system. And I'm hearing school food budgets are really strained too. I mean, they swung into action, haven't been getting reimbursements, and that system's pretty strained. So I'm wondering whether PEBT and any of these things are sort of relieving a little bit of that strain on the system.
Yeah, that's a really good question. And I'm glad you're pointing out the role that the schools have played, because I'm telling you, they are just amazing. I'm a former classroom teacher myself. I taught in the elementary schools for 8 years right out of college. So I get it. You know, I have that sense of the strain that they've been under, though and been in the world they're in today in the classroom. But what we saw when the pandemic happened and we went into shutdown, those schools who were providing backpacks and school pantries, those people stayed in that role. They didn't close down their pantries. They didn't stop distributing backpacks. Because of course we were in touch with them and asking them, and they were saying, no, bring the food. We're going to get it to the families. And in some cases, that meant the school pantry coordinator or a teacher personally driving that food to that child's home. I mean, that's the level of dedication that they have. And the same is true through their meal services at the schools. They had the same interruption in food supply as we did, because we work closely with the Department of Education and with their nutrition department, and they had an interruption in food supplies coming to them to prepare the meals as well. So, but they pushed through those and found ways to continue to not only prepare the meals, but to make them available outside of the school for a drive-through, and the same kind of immediate transition to a new delivery model. The funding has definitely been a challenge. I think they've been working on the federal level as well. In fact, there was some additional funding that came through in the recent congressional relief bill. But yeah, they're going through the same multiple scenario planning that all of us are.
Thank you. Evan, it looks like you are next. So you want to go ahead and ask yours?
Yeah. Hi, thanks first just for sharing. I appreciate it. I have probably an hour and a half worth of questions. So I'm trying to pick the kind of most central piece here. So what I wrote there in the chat, I'm really curious, and this is very directly related to a lot of my research right now, about where especially new food resources may be coming from as you had to pivot so quickly overnight? And I'll stop there for the moment.
Yeah, that's a really good question because we had to do a lot of really quick discovery. Fortunately, I have a team of incredibly talented people who have a background in food sourcing, they call it, which is, you know, acquiring food. And typically we could secure the largest volume of our food within our state. I mean, we all know this is an agriculture rich state. We have so much produce and cattle and lots of really good foods that are available here in Idaho. But you saw the news stories where farmers couldn't get their crops out of the field, right? So it was like, okay, we need that and you can't get it out of. So we had to work through a lot of those interruptions. But to that point, there's a commitment in that community to make sure people have food that's as strong as you can imagine. And so many of those farmers we were able to work with, and they'd say, okay, yes, I'm gonna get enough food out for you guys. I can't afford to pull it out to send it to market, but I'll pull it out for you guys. We also had to go to a lot of outside of Idaho suppliers for purchase. And at that point, it was like, where is food anywhere? We always like to start in Idaho, but when we didn't have the options in Idaho, we had to look nationally. And actually, some of the food was coming over on barges to the, you know, the U.S. location that we were purchasing it from. And there was an interruption on the overseas transportation as well. So our team just was incredibly creative and looking for all the sources that they could find. And lots of delays.
Yeah.
We had lots of delays in deliveries.
If I can build on that, just one aspect, if that's okay. Otherwise, I'll just email you guys later.
Go for it.
So not that this is where the entire solution can come from, but to some percentage, you know, so I've got a lot of research participants just through interviews and observations right now that are like principally local food producers at a lot of different levels, from like backyard gardeners to farmers.
Yep.
And it's pretty common that people that, you know, the folks that have several years of experience that are kind of no longer dealing with the learning curve had surplus in whether they were plants. Obviously that requires a different level of skill to then eat it later, but either they had plants or they actually had food. And I wonder, I guess, did they factor into your resources? And, you know, I guess 8.1, is there ways to increase that interaction?
Yes and yes. And you're bringing up a really important point here, Evan. Hunger is not about a lack of food. We have enough food in this country for everyone to have what they need. This is not about food availability. It's about access and those connection points. How do people get the access to the food that they need when they need it? And when we're talking about our supply chain, I can tell you that, especially during the pandemic, but throughout all of the years, we are contacted by growers, whether they're small or larger, who will say, I have surplus. What do I do with this? What can I do with this? And we love to be able to make those connections. Sometimes it's, here's our address, bring us the truckloads. But even when it's smaller, like the backyard gardeners, people who have the small sources of food, we always promote taking your excess foods to the local food pantry. And we have an easy access map on our website where you can go to the food locator, put in a zip code, and it'll show you all the food pantries that are in that zip code. And we encourage people to use that. Find the pantry that's in your neighborhood. If you have excess produce out of your garden, take it there. They'll be able then to distribute it to the people who are in need. In fact, there's another national website called ampleharvest.org that builds that for the whole United States. So we're always working every way we can. The most, how do I say this? The worst thing that can happen to a food banker is to see food going to waste. It's like, don't do that. We've got to find a way to make the connection to get the food that's available to the people who are in need.
Thank you.
Sure.
I have so many more questions, but I don't want to take up all this time. So are you guys available to be reached and have a different conversation?
Absolutely, would love to.
Yeah, Evan, I sent you a chat with my email address. Just feel free to reach out and I'll schedule something.
Perfect. Thank you.
Awesome. Connections being made. This is
Woo!
great. I'm going to sneak another question in before the other ones. But so given the fact that you guys are pros at collaboration, and that's something that the HCRI and folks in our network are really interested in, what do you think you need to foster sort of successful collaborations and functioning collaborations with different groups? And this is for either Amy or Karen.
Well, I'll just say a couple of things briefly because I want Amy to have time to do it. Thank you for recognizing our involvement in collaboration. I don't know we'd call ourselves pros, but we are committed. I mean, that is one of our core values in our organization is collaboration, because we're not going to end hunger alone. Nobody is. If you're not willing to collaborate, you're not adding the kind of value that's needed here. What I have learned over these years is that it's a journey. And it's not about this conversation didn't go anywhere, therefore we won't talk to that group anymore. It's about this wasn't the right time. Let's come back when the timing is right. That's one of the important lessons I've learned. Go ahead, Amy.
Such a good question. Wow, I wish I had like a really well-formed answer. It seems, especially being fairly new to the role, it's been interesting to kind of dive in to not a new network. I'm a native of Idaho, and through working with the care coordination program, very aware of what collaboration and connections look like. But it seems to me that so much of it is still that personal connection and just being open-minded and listening, which sounds a little bit cliche, but I think as much as we can go into conversations not expecting that we have the answer and willing to learn from what the other person has to say on multiple sides of the aisle, that I think is the essence of collaboration, is just that listening, learning, trust building, respect. And if we're all focused on the same mission, then hopefully we'll get there eventually. There is also something to say for a good process and some utilization of maybe some technology tools in which we can be more efficient with it, because I don't think we need to stay in the, I'll talk to 10 other people. But the other thing that I'm interested in is looking at this, and it ties again from my work with care coordination. There's so much heart and soul and want to do good, working with the community of Medicare and Medicaid population individuals. They were getting coordinated by like 6 different people who just wanted to help. But then we were getting confused because those 6 people weren't talking to each other. And so I think that maybe shows up in a lot of different spaces. There's so much help. Let's make sure the helpers are coordinated too. And how to get that done, again, is this huge question mark. And I think there maybe needs to be some sort of local champion, either in the local community, but yeah, so I think that would be my 2 drives as far as strategy is being smart, efficient, and then just open hearts, open mind about it, and let's look at new solutions.
Thank you. Yeah, I love all of those thoughts. So thank you. Let's see. Greg had a question about how growth, and Greg, maybe you can clarify this. Are you saying how growth in the need for food is related to Idaho's population growth?
Yep. That was the question. Yeah,
okay.
Thank you.
Yeah, that's another great question, because there's a direct correlation. And in fact, pre-pandemic, we had developed our 5-year strategic plan. And one of the key factors was the population growth in Idaho. I mean, there's really good research, and unfortunately, the percentage of food insecure people in a population, you can trend it, right? So we're using the data, we were able to project not only the total number of food insecure people over that period of time, but also by region and by age. So looking at children, families, seniors, and identifying where we could expect to see that growth. I mean, I think one of the things that we saw with the population growth in Idaho, a lot of the people who are moving here were retired people, right? A lot of growth in the senior population. And when we saw a lot of people moving to Idaho, I noticed there was this perception that everybody moving to Idaho was coming from California with a trunk load of cash, right? They were bringing all this money, and so they wouldn't be hungry. They wouldn't need our services. Well, in fact, there were a fair number of people who were moving to Idaho with hopes and dreams and not a lot of cash. And it wasn't uncommon to hear the stories and meet the people who didn't have a place to live. They didn't have a job. They were running out of the resources they came with, and they needed help. So back to your question, yes, there is a correlation between the population growth and food insecurity.
Maybe as a clarifying point or follow-up there is, so how is it trending in terms of proportion then? Is it more severe, less severe relative to the growth?
More severe, less severe than what we had projected? You know, at this point, I can't tease that out because the pandemic has just clouded all of our numbers. So I'm not able to, we'll have to look at whether or not we can correlate that to the population growth. We've been working with a gentleman at the University of Idaho who does really great research on population in the state and tracking it by location and by age. He would probably love that question to do.
Thank you.
All right, next question. Tara, do you want to go ahead and ask your question? She's on there. Well, I can ask it for her because she did type it in. Okay. How have you seen the quality, produce freshness, nutritional properties of food distributed through the food bank change due to the increased demand of food because of COVID?
We're really fortunate. We haven't seen a shift in the quality. And I think this is another important item to clarify, because sometimes it's the misperception that food banks give away food that's about to go into the dumpster, that it's low quality. Well, we don't do that. We inspect all of the food that we receive before we distribute it. If it's not good, we throw it away. And we work really closely with our donors to help them understand we need good quality food. So oftentimes with us, it's fresh out of the field. This is not the end of life product that they're donating to us, because we need to keep our scrap load, the food that we're throwing away. And right now that's at about 2 to 3% loss for us, which is really good. That's low for a food bank. And credit goes to our donors. They get it. They understand the quality and the freshness that we need in that donated produce. It does mean we got to move it fast. And again, that's where our volunteers help us with that.
Okay, I think we have time for maybe one more question, and I like this one from Greg. To what extent does the stigma of poverty and handouts play a role in who does and does not take advantage of your services, especially in rural areas?
It's significant. It is significant, and we are always trying to address that in every way we can to remove that stigma and reduce the judgment. One of the things that happened in the pandemic, and we've learned from this, and we're still trying to understand it even more, we started a new distribution model that we call our community distributions. So I showed you the network of pantries, and we talked about our mobile pantry. Well, we knew we had to expand our distribution channel immediately and significantly. So we implemented these community distributions in 11 different high need areas, high volume areas like Nampa, Caldwell, Mountain Home, Rexburg, Moscow, Lapway, where we knew we had a population that didn't have access to the food that they needed. And we'd roll in a truck, and you may have heard some of the advertisements that we were going to be at the Idaho Center for these hours distributing food boxes. Made it publicly known, and then we'd roll in with usually 2 trucks, and cars would line up, and they, just like you see on the news, they drive through and we'd load the boxes in the back of those vehicles. What we've learned from that is a lot of those people hadn't experienced food insecurity before. They weren't aware of the partners that were in the community for accessing food, and they weren't comfortable going to those partners, those known organizations, because they didn't want anybody to see them going to that pantry for food. But these community distributions are very anonymous. In fact, one day I was like, I need to know why this is so appealing to these thousands and thousands of people who are coming to this. So I went down to the fairgrounds for one of the distributions, and I got in the line in my car, and I went through just like everybody else was. And in 15 minutes, I was through the line, and I had a box of food loaded in the back of my car, and I got it. It was like, that was so easy and so anonymous. I understand how that's very appealing to a lot of people. So, there's something for us to learn from that.
And I'll just add very briefly, I know we're running out of time, but something else we've discovered is, in addition to the stigma barrier, additional barriers that are present for different communities in our state. So for example, like the Latinx, Hispanic communities, some of them are fearful of what type of documentation might be required to access the food box, which inhibits them or presents a boundary for them to want to come to access it. And in addition, the tribal communities and our Native American reservations have different ideas of what type of food they would like to receive, and they don't want the idea of a handout from anybody who doesn't respect them or understand their culture and community. So yeah, there's a lot of different things at play for even making sure that we're offering the dignity to individuals to access the boxes.
And just to add to that, we do not require any identification, but that is a misperception. We have to continue to communicate. You don't need to show any identification. If you're hungry, you get food.
Awesome. Well, thank you both so much for being here. It's been just wonderful to hear about the work that you're doing. So yeah, it's virtual applause to everybody. And hopefully we can kind of keep this conversation going as we continue to work on resilience in the Treasure Valley. So thanks everyone who came, and Karen and Amy, if you want to put any links in the chat, feel free. I haven't added the link to our little small grant, so I'm going to do that. If you're interested in checking it out, feel free, and we will see you guys in a month. So thank you.
Thank you so much.
Thank you, everyone.
That was great. Thank you.
That was fun. Thank you. You guys, I'm so glad you do this.
Inspiring.
Yeah, it really was.
Well, I hope it just creates more conversation. That's what I love about this. Like, this is, can generate even more connections. And yeah, thanks for doing this. You guys are